Hey guys, Melvin here from hairtransplantnetwork.com. Today I want to talk to you guys about hair transplant longevity. Do hair transplants thin? Are they permanent? Well, that's what we're going to find out today. I asked three world-class surgeons, Dr. Ron Shapiro of Shapiro Medical Group, Dr. Jerry Wong of Hassan and Wong, and Dr. Christian Bisanga of BHR Clinic, whether hair transplants thin. All of these doctors have decades of experience between them, so without further ado, here are their responses. I mean, what do you guys think about do hair transplants thin over time? I mean, Dr. Shapiro, you guys have been in the business for decades, so you guys can speak on actual, knowledge.
I wish I have patients that I've done 20 years ago, and that still look great. I mean, they come back in, they look great. I'm surprised, but because if you do it right and you do the right pattern distribution and you're using the good hair, they can still look good. Now, they do thin. They do thin, not totally. It's not they lose all of it, but the hair does thin. In fact, it used to be that the people that used to do the big plugs, where they get the pluggy look, those patients would come back 20 years later and they'd look better because now they don't look as pluggy because it thins. Your native hair back here will thin a little bit, and by thinning we mean the caliber of the hair. It goes from a thumb to like this. It starts to thin as you age. The hair in the non-permanent zone will start to thin sooner, and you never know what percentage, how much of that will be lost. I mean, because some people lose their hair weight. I mean, if a person's going to become a type 6, obviously they're going to lose a lot of that hair. If a person stays like a type 5 and they still have that donor, that hair's still going to become finer. And a decrease in caliber is just as important as a decrease in number.
Yeah, almost more so.
I have patients where I did a 1,500 grafts on 20 years ago, and they got a super great result. I did 1,500 grafts on 20 years later. They wanted a touch-up, and they didn't seem like they got quite as much. And the reason is every hair was about a quarter decrease in caliber. So the same number of grafts is not the same volume of hair. So there's a lot of factors at play there. The hair transplants should never be said permanent. That was said years and years ago. We haven't said that for years. It can thin. Now, if you plan it properly, that thinning isn't as much of a problem.
Do hair transplants thin over time? And you being in a position where you have patients probably that you've known for well over 20 years, have you seen that in your practice? What are the factors that contribute to a hair transplant thinning over time?
Uh, Hair transplant actually do thin over time. Uh, uh, Again, going back to medication, if people, say take finasteride or sometimes dutasteride, and they respond well to it, transplant hair, the thinning is not that significant. I have people that have a transplant that's 15 years ago, and if they take the medication, they're still fine. But people who can or won't take the medication, the transplant hair, they do thin out. Sometimes in some individuals, it thins out quicker than others. It's really hard to predict, how long hair transplant will last. There is, I think there's something about the recipient's scalp, and a lack of a scientific term. Some scalp tissues are much more friendly to transplant hair than others. So I've had an individual I transplanted 27 years ago, a young man, and he's been taking finasteride on a regular basis since then, and he's lost very little hair. We did the transplant on him, and he's still fine.
Yeah, so that kind of hits on the point that medication is so important, and taking preventive hair loss measures is important if you're going to get a hair transplant because even the transplanted hair could thin over time.
And we're talking about the longevity of the transplant. When I see patients that I did transplant 10, 15 years ago, you can see that the overall volume has shrunk. So there's a possibility that with aging, that the quality of your hair is going to decrease. So not taking into account medication to try to make it last, it's a mistake. I know some doctors do not recommend medication, but we really have to look into medication.
Yeah, it was, I asked I asked this question to Dr. Wong, and I was actually going to ask you guys and I've been asking most of our doctors is, do hair transplants thin over time? Because some people, back in the day, people used to say hair transplants are permanent forever. It's never going to
No,
thin.
it's not permanent forever. That there's nothing that is permanent forever. I always tell patients, even our life is not permanent. So hair, unfortunately, as everything else, will age as well. So if you can keep your hair transplant good for 10, 15 years, then you should be happy. I think the evolution of hair loss is unpredictable, and I've seen some of the result of being in the field for the past 20 years. It make you really appreciate and seeing patients that you did in 2002, 2003, where they used to have a wow result back then, but when you see them today, it's not as wow as it used to be, because so yes, the hair thin over time, and people should be aware of that.
As the late Robert Frost once said, nothing gold can stay. We're all getting older. No matter what we do, no matter what we eat, aging is inevitable. As our bodies age, our cells work slower and slower and slower. So the answer to the question, do hair transplants thin over time? Yes, but every living person's hair will thin over time, even if they don't have genetic hair loss. I'm going to leave you with one last piece of valuable information. Look up real reviews before choosing a surgeon. I'm not talking about those Google reviews that can be written by anyone. I'm talking about the reviews you see on the Hair Restoration Network forum. Hair transplant reviews that show the gradual progression of the hair transplant from start to finish. You can't fake those reviews.